The state's top health official is out. Today was Ed Ellinger's final day as Commissioner of the Minnesota Department of Health. Deputy Commissioner Dan Pollock is temporarily taking over.
Katherine Johnson tells us the troubles that led up to Ellinger's exit and the hope now for changes. Katherine.
Yeah, guys, the Department of Health declined my request for an interview today, and I was instead pointed to a news release that says the acting commissioner will immediately work to improve efforts to protect seniors and properly investigate allegations of maltreatment and abuse.
I was just devastated and in shock when I found out what had happened.
They're the families Mark Kosharatsky says have consumed about 90% of his law firm's work over the last 15 years.
We started investigating these cases and finding out more and more. And it was 1,000 times worse than I ever imagined.
Complaints regarding the treatment of Minnesota's seniors in assisted living have long been largely neglected. Earlier this year, the legislative auditor launched an investigation, noting since 2010, maltreatment allegations received by the Office of Health Facilities Complaints grew from less than 4,000 a year to more than 24,000 a year. In 2016, the OHFC, which is part of the Department of Health, was only able to investigate 2% of those claims.
One of the state's top health officials admits they're struggling to fulfill a promise to watch out for the most vulnerable.
Last year, a 5 Eyewitness News investigation revealed data that showed the majority of the health department's investigations also weren't being completed on time.
We have clients who call, file complaints that never hear anything. It never sees the light of day.
With a sudden shift in leadership from now former Commissioner Ed Ellinger to interim Commissioner Dan Pollock, Kosharatsky is hopeful it's the beginning of significant change he's been waiting on for years. Still, he doesn't plan on slowing his work anytime soon.
We see women being raped. We're seeing drugs being stolen. We're seeing people being overdosed with drugs and killed. Minnesota absolutely needs an elder abuse law.
Governor Dayton will soon appoint a new commissioner, but this isn't over yet. The legislative auditor is expected to finish his report regarding senior care sometime in the coming months. He couldn't tell us what he's uncovered so far, but he did say he recently conveyed concerns to the now former Commissioner Ellinger and other state leaders regarding his findings. In the newsroom, Katherine Johnson, 5 Eyewitness News.
Katherine, thank you. Ellinger's resignation is one of several changes regarding senior care in Minnesota. The legislature has added nearly $9 million to hire more investigators and reduce caseloads. Data will soon be moved to an electronic system to more easily manage cases. And Governor Dayton has created a group to come up with ways to better care for seniors.